For our facilities, we basically specialize in ventilator patients and medically complex trach collar patients. We are able to continue weaning patients here off the ventilator, and we also take chronic ventilator patients for long term. Everyone's situation is different. Some patients, we may admit them knowing that they're going to be long term, depending on their diagnosis. Other patients do really well and they wean and they are able to move on. But we can do either depending on what their situation is. Typically for an admissions process at Fox, most likely our patients are coming from an acute care hospital setting. So we would get a phone call from either a social worker or case manager at the hospital. Typically they initiate it with me or one of our clinical liaisons. And we either have them fax information or our liaison actually goes out and does an on-site visit. So commonly it's from the hospital. At times we might admit from another skilled nursing facility or from home. Basically they contact us, we evaluate them clinically, and we start the insurance process, checking to make sure we're contracted and that they have, everything financially set. And then we work with the family and the hospital to bring them in from there. What I think is different about Fox, and I think that we stand out from other competitors, is because we only specialize in ventilator and trach collar patients. I think what's nice is we have 3 facilities. We have a lot of the same staff that works in all 3. We have an admissions process from a centralized office. We do all the admissions through one office. And I think that that's why we stand out, because our staff is well trained in that type of patient, and some facilities don't have, they have lots of different types of patients, whereas we specialize just in that area. We do get referrals from all over Pennsylvania. We do also get them out of state. Not only do we specialize in the ventilator and medically complex trach collar patients, we're also able to do vent and trach collar and dialysis patients. So we do dialysis at bedside, and because we are so specialized in that area, we do have 24-hour nursing and respiratory. We have specialists that come in and see the patients. We have nephrologists that come follow the dialysis patients, pulmonologists for following the patients with the ventilator. And I think because we are so specialized and we have those resources available to us, it does help with the patient's well-being and their medical management.